This week, multiple top officials at the Centers for Disease Control and Prevention resigned, citing political interference and budget cuts from the Trump administration. These resignations came as Health and Human Services Secretary Robert F. Kennedy Jr. announced the firing of CDC Director Susan Monarez after White House officials say she refused to sign off on upcoming COVID-19 vaccine recommendations from a medical panel that Kennedy had stacked with vaccine skeptics. With their resignations, 4 officials who left in protest this week are sounding the alarm that an emergency is unfolding in our public health system. Dr. Jennifer Layden, one of the 4 CDC officials, joins me now. Dr. Layden served as the director of CDC's Office of Public Health, Data, Surveillance and Technology. Dr. Layden, thank you for being with us. And I do want to just sort of mention some of the other things about you. You're an infectious disease physician. You're the former deputy director of the Office of Sciences Center for Disease Control and Prevention. You are the former lead of the CDC's COVID-19 vaccine task force. You're the former deputy commissioner and chief medical officer of the Chicago Department of Public Health. So you know a thing or two about public health.
Yes, thanks. And thanks for having me here with you.
So here's my problem. It's like the conversation about the Fed, right? I can't tell people why it's bad to fire the head of the Bureau of Labor Statistics by explaining labor statistics to people, or the Fed governor by explaining Fed economics. At some point, we simply trust that organizations like the CDC are staffed by people like you who know things that I never will know and shouldn't need to know.
Yeah, absolutely. So as you mentioned, I've served in public health for many years. I was actually the chief medical officer for a state, for a city, and then I've been at the federal level for 5 years. And before that, I was an infectious disease practicing physician. I relied on CDC in all of those positions. As a clinician, when I had a patient who came in with a cough, I'd want to know what was spreading in the area that they came from or were so that I could diagnose and treat them. For clinicians that are seeing patients with drug-resistant pathogens, it's public health data that helps to inform their diagnosis and treatment of the patients. When I was at the state level of public health, I relied on CDC on a daily basis, whether it was a measles outbreak or a Legionella outbreak or dealing with an unknown outbreak. I would call the experts at CDC for guidance, support, and oftentimes would bring them on the ground to help me with the unusual circumstances.
And this is the important part, because as a patient who goes to a doctor with a cough or whatever the case is, I don't know all this background stuff. I don't know that my symptoms will be entered into something, and I might be in a rural place, but somehow the CDC will have now figured out, wow, dozens of people around the country are reporting this combination of symptoms. Hey, doctor, take a look. Let's test for this, or let's figure out whether there's an outbreak. So there's this whole data and surveillance. I don't mean to use this in a bad way, because surveillance sounds like a bad thing, but the health surveillance is a massive part of what the CDC does.
Absolutely. And not just the CDC, our state and local health departments as well. The work of public health often goes unnoticed until there is a major outbreak, until there is a major pandemic. But it's the day-to-day work of public health that keeps Americans safe. And that is largely driven by data. Data is at the core. It's an essential utility for the work of public health. Think of if you were on a plane and there was someone who was on that plane that ultimately was diagnosed with viral hemorrhagic fever. You would want to know. You would want to be contacted. It's the work of public health that does that. And it's our complicated systems and the flow of data that allows us to do that, to inform you, to ensure that you get the best care that you need.
So it doesn't sound like your job would, on a daily basis, lend itself to being ideological or political. So what's the line that was crossed that caused you to leave?
Yeah, but public health should be bipartisan. The work that we do serves and protects every individual, family, communities across the nation, regardless of where you live. For me, coming to public health, leading the data office, I knew it was essential that we continue to improve and modernize our data systems. Our data systems were antiquated. We have not invested in public health for decades. During COVID, we saw that, we felt that, and thanks to federal investments, we started to improve those systems. And we made tremendous progress in the last 5 to 6 years across our nation, not just at the CDC, but our jurisdictional partners.
So this
over the last 6 to 9 months.
I'm sorry, I didn't mean to interrupt you. Go ahead.
I was just going to say, during the last 6 to 9 months, it became really critical and challenging to do my work. So in my data office, I lost 30 to 35% of my staff that had expertise that was essential for our systems. We were unable and very challenged to execute on contracts that kept some of our major systems running for our nation. So as it became apparent that I couldn't be effective in my job at the federal level, I felt that as a clinician, as a public health expert, it was important for me to look outside of the federal government for other ways to serve our nation.
So one thing we realized, and it was during COVID, that when somebody tries to politicize organizations like the CDC or the World Health Organization or whatever the case is, they always lean into the idea that there are things wrong with it and they need reform. Nobody I've spoken to who worked for the CDC in the recent past or in the distant past has disagreed that these organizations all need constant updating, reform, whatever the case is. I can't imagine that even you disagree with that, but that's not really what this is about.
No, not at all. I mean, I 100% agree. I think we need radical transformation of our public health systems. One, that doesn't happen overnight. Two, it needs resources. We have not invested in our public health ecosystem. You look at how we've invested in healthcare and our healthcare IT, electronic health record systems. We've poured in over $35 billion into those systems over the last 2 decades. We only started to invest in public health data modernization 5 years ago, with less than 10% of what we've poured into electronic health record modernization.
Dr. Layden, thank you for being with us and helping us understand this a little bit better. Dr. Jennifer Layden is a former director of the CDC's Office of Public Health Data, Surveillance, and Technology.